Good. All right, we're back again and had a specific request to help someone tackle hip internal rotation. So I've got a few variants of that we're going to show you. We'll do one in flexion and one in extension, and then you can kind of gauge what would be more appropriate for you. It's a good opportunity to kind of talk about joint capsules as well, though, and the function of those, particularly when that is one of the main things that can be restricting, say, rotation about the hip or shoulder. I mean, if we think about stretching in terms of just soft tissue, as an example, the hip, if we do pure extension, we will maybe get a little bit of, say, the front of the hip capsule, but a lot of that is just going to be restricted by the soft tissue above it. So in theory, you have to get through all that first before you can get down at the joint capsule. And then it turns out, due to the nature of joint capsules, and if we look at the hip, the surrounding ligaments like the ischiofemoral ligament, iliofemoral ligament, things like that, that you almost need to combine movements to really stretch a capsule. So if we're talking about the anterior portion of the hip capsule, turns out we're going to want to extend and laterally rotate. So we're going to need two movements to really get at the capsule. Now we can kind of take that a step further as well with bands and distraction, and actually just mobilizing a joint within the socket. So we talked a little bit about that in the previous video when we gave the example of hip impingement and having that hip at the front. If we can get in and move it around, all of a sudden it's not as restricted, it's not as tight at the front. And that can be with any type of position. Maybe your femur's rotated one way too much and we just need to kind of get in and loosen it up. So that's the second step up we can do when we want to encourage joint capsule mobility. So we'll do two. The first one I'm going to show you we'll do for extension. And I like it just because it gets a lot of rec fem too. It's just a basic couch stretch, which you've probably seen before. So we're going abs tight, glutes on. So this will get a lot of the hip capsule, but again, we need to kind of combine movements. So what I'm going to do is I'm going to put the band on. So again, we get that kind of distraction translation force in the actual joint. And then we're going to add in the rotational component. So I want that right under my glute. Now this might be enough for some people, but if I want to actually improve internal rotation, what I'm going to do, pin my foot down and start walking myself and pivoting over this way. And I'm going to push myself out like you're doing a bit of a lunge stretch, but I'm going to do it at about 45 degrees out that way. So I would actually try this without the band first. You can, again, move around, hunt around, but find any position where you're really tense and kind of hang out there. That's where you want to spend your couple minutes. Second one we'll do in flexion. So if you're looking for maybe a mobilization for squatting, because again, if we talk about these Starr principles, these Mulligan principles, we want to be mobilizing in the position where we're most restricted. So what we're going to do, I'll do the same hip. I'm getting that right up, going into 4-point. Now this alone is just a bit of traction on the hip. So again, if we want that internal rotation, I'm going to hook my leg around something and just hang out there. What I can do is push my ankle in, contract it, relax it, and then try and get a little bit more. Hang out here for a couple minutes, pivot around if you need to, but this is probably going to be enough. But again, if you need more, push in, drive your ankle in, relax, try and get further. So that's going to be a little more mobilization for when you're actually in a flexed hip position, just like bottom of a squat. So there's two for you, flexion, extension. Pick one, find one that works for you. Hope that helps.